Hi, this is Gail Trauco. Today we're going to talk about grief associated with medical uncertainty. This could be medical uncertainty of a new diagnosis for yourself, a family member, or a friend. Could just be someone you know. And it's probably one of the most traumatic, unexpected news events that will happen in your life when you are sitting in the room and the doctor walks in and he uses the big cancer word. Maybe somebody has had an unexpected heart attack. They didn't even know they had a heart condition. The first thing you want to do is step back, catch your breath, determine the severity of the medical condition, and decide where you want to go from there. If it's a terminal illness, that's a whole new game and a whole new set of rules apply. If it's just a new medical diagnosis that requires treatment, and cancer certainly is very serious at that diagnosis. If you need surgery, if you need chemotherapy, whatever the condition is, you need to get a second opinion. And you can discuss this with your physician. There may be a physician in the same clinical practice that can give you a second opinion. I recommend going to another institution. Certainly you have to wait for insurance clearance, but your physician can guide you in how to do that. Have a great physician, one that you can build a relationship with, one that's not going to walk in the room and spend 5 minutes with you and not pay any respect to the questions that you have as a patient, but one that's going to sit down and answer those questions, one that returns phone calls and one that answers emails. That's what you want when you get this type of a medical diagnosis. My second opinion, I do recommend going to a major medical center. If it's cancer, the MD Anderson Cancer Center, Duke University, Johns Hopkins Hospital, University of Pittsburgh Medical Center. Go to one of the major teaching hospitals that are easiest and most convenient to get for you. See a key opinion leader. They will confirm or they may add to the medical diagnosis that another physician has had. Other things that you need to take into consideration are there things that can be delegated to family members or outside friends, transportation issues, cost of housing when you have to travel for another medical condition, and that second opinion consult. So many factors come in. Many medical centers have inexpensive housing. A patient can stay at for as little as $7 a night while they're receiving treatment or when they come in for a consult. Ask these questions when you make that phone call to schedule that appointment. The other thing that you want to take into consideration is, what is your timeline? How long do you have to take action? If it's a minor new medical diagnosis, you may need a biopsy. You come back again in 90 days for another ultrasound or a scan. That's not anything that you should be particularly worried about at this moment. You certainly don't have to rush home this afternoon or tomorrow morning to make those phone calls to get a second opinion. If it's a terminally ill diagnosis, you certainly want to have them reach out to their social worker, their patient navigator, and even a hospice. Many church groups have what's called grief share, where people come together, and it may be on Wednesday nights, it could be on Sunday nights, but it's where people who are going through any type of grief cycle are share, and they're there to support one another. The internet can be a great resource group. There's chat rooms on Facebook and on websites. National Institute of Health has a wealth of information for most medical diagnoses. Are you going to spend time on your front porch in your rocking chair? Absolutely. This is a critical time for you to maintain your calm, to try to stay out of a panic mode, to ask good questions, to think clearly, eat properly, get a lot of sleep, drink a lot of water, and eat as healthy as possible. Just feel good. If you feel like you need a candy bar, you might as well go ahead and eat it. So, I didn't mean the whole bag, I just said one. Do what it is that feeds you, that brings you back to this place where you can function. You always want to see if you can find that place again, where you have that peace. You will never forgive yourself for having a medical diagnosis of uncertainty, especially if it's a terminal condition. You may come to live at peace with it, with the support around you, especially if it's something that you may have a history of. But we always are the hardest on ourselves, especially when you know you're going to leave others with a loss. Post on this blog, let us know if you have a critical illness that you need help researching, you need help finding resources for. If you know someone else does, post it there, Facebook or on this blog. We may be able to refer you out and point you in the direction of free resources to you. Thank you for listening. I look forward to seeing you next time.